Hi, welcome back to Ageless Anatomy Podcast. My name is Brooke Bangart. I am a certified laser technician and partner at Ageless Anatomy, and we are here today with Logan, one of our most amazing patients, and he's willing to discuss a few things with us.
And I'm Dr. Brianna Kane. I'm along for the ride here today. I am a partner at Ageless Anatomy and a naturopathic physician.
So, Logan, we've been through it, haven't we? So, why don't we start out with talking about your first experience with us here at Ageless Anatomy? I think when I met you through, I believe, one of
Josh, I think it was.
Oh yeah, Josh. And you're a chef for some very important people.
Yes.
And at that time, I think we, one of our professional athletes was seeing you, and you've sent us a lot of clients over the years as well. But tell us about your own experience with us.
Yeah, I would say like my first meeting or whatever with you, I did Forever Young BBL, I think it was. And that for me was like incredible because my whole life I thought I had freckles all over my face. Like my family has kind of lighter complexion, and as I aged and had been in the sun, I developed a ton of freckles, what I thought were freckles, and I just thought that's what it was. I was gonna be very freckly and everything, but I did the Forever Young BBL with you, and I pretty much had them almost like scab off my face and fall off like just a little thin piece of dead skin. And then my skin was incredible. It was like I had hardly any blemishes on my face at all. So that was like incredible difference, just that there alone. So that was my first, I would say, like experience with it. And then I've had multiple other procedures and things done just to do kind of like be your model for a lot of things. And I would say a lot of them, the difference you don't see right away, but the main difference was when people would come up to me out of the blue and be like, oh my God, your face is incredible. Your skin is so clear, or your skin like texture is like so smooth, and I would never come up to somebody and do that out of the blue. So I feel like it would have to be a pretty big difference for somebody to be able to do that, Right. So I feel like that was my first main thing that I was like, this is incredible. And then I've had some things done with Dr. Kane. Like the best thing I feel like I did was the HCG, that I did that for a little stint, and that really changed like my body, and I felt like it was better than the testosterone that I did for a little bit because it's like sustained. Like I haven't had to do anything since I did that for a year and a half, and I feel like my testosterone levels have been perfect since then. Because with the testosterone, it would be up and down, you'd have the differences. But I've been pretty leveled off. Like, I feel like I've been in the best shape of my life, feel better than I've ever felt. And, a lot of people tell me I look better than I've ever looked. So,
the funny thing is when you talk about, and I may have said this to you because I say it to a lot of clients that come in and say, well, I kind of like my freckles. And then I ask them how old they are. And if they say they're over 30, I say that, if you're over 30, they're not freckles anymore. They're actually age spots.
Yeah.
And they're like, oh, my gosh. So then they want to get rid of them.
Right.
So it's funny that you say, well, I thought I was freckly. But I have a question for you, what he brought up.
Okay.
So with I don't know a lot of, everything, what she does. But as far as when he was talking about the testosterone and the HCG, how does that work where it kind of balances?
or how does it differ from each other?
Yeah.
Yeah, that's a great question. So when we use exogenous testosterone replacement, we're obviously substituting your natural testosterone. And it's usually, we reserve it for older men that are not really capable of producing as much testosterone just due to age. So we have a lot of other tools in our bag, other medications, other hormones like HCG that can stimulate the production of certain hormones that signal your body to make its own testosterone. So when you're really young, those hormones are pretty active, and we can give your pituitary that signal, and it will, stimulate testosterone naturally. So for younger men, we often can get a good result out of that, and we can balance their testosterone levels using their own body. So sometimes it's better for younger guys to do something like that, like in your case, versus, to actual testosterone replacement, which is better to reserve for older men when they're not as good at making their own testosterone. So that's kind of the connection between the two and the difference. So tell us, of all the procedures you've had done at Ageless Anatomy, what is your favorite?
I would say probably the BBL, just to be able to keep up with it and stuff. I feel like it's the most affordable and routinely you can keep up, and I haven't seen an age difference in myself in 10 years almost, because I think it's probably been maybe 8.5 years since we've known each other, and I've been doing things with you. So I mean, I honestly almost look younger than I did when I was 30. So
I mean,
That's
you
the
do.
goal, right?
Yeah.
You have amazing skin. It's just and I use the analogy sometimes with clients where I say, well, if you have a glass that has spots on it, or a plate, and if you leave your car and you don't dry it off, and it's kind of the same thing when you get those things clear, you just look so much more translucent, and that's how we looked like when we were in high school and younger.
Yeah.
Just glowy, and
Right.
it's natural. It's not anything that will change the shape of your face. We're
Right.
just boosting your cells to do what they need to do, which is speed up and move that stuff off of there. So
Right, and I
yeah.
feel like as a man and as a guy that that's a procedure that is super easy for them to do, and they would look incredibly younger and have much more youth in their face. And it's something that you really don't have a lot of downtime, and you can definitely do it and see this incredible difference. And I always try to stress to the people that I know and stuff like that they should do this. And
Right.
and even women, where I'm you spend so much money on these facials that do hardly anything. You look superficially good for a couple days, and then your skin and everything goes back to where it was. You should be just saving that money and do it quarterly, and you would be turning back the time and not just trying to put lipstick on yourself again.
Yeah, put lipstick.
All over your
And
face.
It actually does. The BBL Forever Youngs can change gene expression, so your cells don't remember how old they are. So it's not just the spots that are missing, but every time a new cell is made and comes through, it comes through with more elasticity and collagen, and so it's nice.
Yeah, it's you have baby skin.
Have that
again.
bounce back.
Maybe you could talk about, both of you actually could talk about what patients can do or what you do outside of the office to maintain your results.
Oh, yeah.
Well, what I personally do, which I've found is incredible, is I stick to a routine of washing my face twice a day, morning and night, and then moisturizer at least twice a day at least. And then the sunscreen, I do a lot more than had done ever in my life. Still probably don't do it as much as I should, but the sunscreen definitely helps, and especially in the summertime, I'm really, really good about it. This time of year, I'm kind of I'm a little more lax, which I still shouldn't be.
Yeah.
But I feel those are very important, and a really high quality face wash and moisturizer. I use the Skin Medica that I started with you. I feel that cleanser, the gentle one, is amazing. It's not too harsh on your skin. You can use it 5 times a day if you want. And sometimes I am washing my face that much because I'm in a greasy kitchen, I'm in the dirt, in the dust, and all that stuff. So it just feels really good to get it off. So I've kind of gotten into a habit of that and gotten into a place where it feels good to do it. So
Yeah.
putting the moisturizer on your face is like the favorite thing in the morning. You're like,
Yeah.
I mean, and Logan also, I mean, you commented earlier about seeing people at the gym and everything. We go to the same gym, and it does help to prevent that aging and keep everything moving in your body to work out. And Logan's really good at that as well. He's
yeah, and I definitely like to keep a routine, like the working out and stuff too. And like I wasn't really into that as much either in my 20s and things. I didn't have kind of the free time, but I feel like it all goes together. Like my hormones are in a good place. Like I feel like I'm in a good place visually when I look at myself in the mirror. And so all those things go together, giving you motivation to go to the gym, giving you motivation to keep all those things. And so those all build on each other, you know, and like a lot of people don't realize that, you know, you starting with one little thing, like you see those improvements and it makes you excited, it makes you happy, makes you want to do more and more. And same thing with like doing a little bit of like, you know, a facial thing or doing, you know, if your hormones are off, because definitely your hormones being off, your emotions are not the way they normally are. You know, you feel down, you feel not good about yourself. And a lot of that is hormones, and people don't really understand that too. And it doesn't have to be that you're like depressed and in your home like with the lights down and, you know, watching sad movies all the time. Like you can be depressed and functioning and doing things every day and everybody thinks you're happy. It's like you mentally inside feeling, you know, and like those things change when you're like all good with your levels of your hormones and like different things like that. So I think all in all, like again, like what you guys stand for is helping make people feel young and youthful like they did before, you know. So I feel like that knocking it out of the park.
It can. I mean, with phones these days and the stressors of life, and then genetic wise, any sort of, you know, anxiety or mental things, you just there's a lot that people deal with out there, but I get it.
Yeah.
But what's interesting is how much having good skin can change your mood.
Oh yeah.
And change your emotions. And
When
how
you
feel
look
about
better than what you
yourself.
feel inside, then it
Yeah.
changes it around.
It really does.
It does.
I mean, just that little look in the face. And
Yeah.
it's kind of nice too, because with those procedures, you do kind of look like scary AF for a few days. So like when you're like, oh my God, what is going on? And then slowly you like start to heal. But it's literally the months later when people are, and you've not forgotten, but you've forgotten about what has happened. And then you start to realize that like, this is unusual. People, like so many people have come up to me and been like, you look incredible, or like your skin looks so great, like you're glowing or blah, blah, blah. And so that's when you know that like, this is worth it.
Yeah.
Worth every penny. So
Yeah.
Because how old are you now, if you don't mind me asking?
I just turned 40 in November, big 40.
Yeah.
And like, if you would ask me how I'd feel about turning 40 like 10 years ago, 12 years ago, I would not have been
Start
happy.
crying?
Yes. Yeah, a breakdown. But like, I'm so excited for my 40s. Like, I'm very excited about it. Feel really good. I'm like super excited. So
Yeah.
That's awesome.
Bones feel good, everything. What else? What else have we done?
oh yeah, the PRP.
The PRP, forgot about that.
Yeah, I wish that would
Oh,
last
that's
forever because that thing, I mean, it was kind of extensive as far as like sounding scary and everything, but it like did the biggest difference as far as like, because one of the things that is something that bothers me is the lines underneath my eyes, and it's kind of genetic. Like all my family has the darker lines under their eyes and heavy, and we did the PRP in the eyes, and that really helped. It helped like just lift it a little bit and then give it a little bit of color, which was super surprising. I really wanted to try something when I was talking to both of you about it. And I was like, I didn't want to look like, you know, some of the other people. I know some people that have like
fillers
that you do like in your lip and stuff there, and it just looks so puffy. You don't get a natural like look, no matter anybody that I've seen.
Yeah.
So I feel like the plate or the PRP in the eye, below the eye, was like definitely the ticket for anybody that's looking to get that done or like help that area.
So why does that, with darkness and everything, because how many times did you have it done?
I think I've had it done three times.
Is it just, what is the process under the eyes? It just helps to speed up circulation and
Well, it does a number of things. I mean, platelet-rich plasma, PRP, is full of growth factors. And as we age, and some people have a genetic propensity to this, you lose more collagen under your eye. And you start to see the hollowing of, honestly, the eye socket. And so if we can introduce PRP to the tissue, it'll help to regenerate some of that tissue, thickening the tissue, bringing it away from the eye socket so it doesn't look as dark. And it also has some tightening effect to reduce fine lines under the eye. But not everybody's a candidate for filler, as you mentioned. It takes the right person for filler to really look nice there. But almost anybody can do PRP. And I've often had great results with it, but it does take a series. So yes, 3 to 5 is typical.
Yeah.
Yeah.
And the thickening of the skin, I think, was the biggest change, because like mine, I can tell, is incredibly thin. So like after that procedure, I definitely could tell that it was thicker, which makes it so you can't see through it as much.
Yeah. Right. Exactly.
And I had the PRP hair before. I've had that like 3 or 4 procedures or sessions of it. And I feel like that's definitely a good thing too, but it's something you have to keep up with, because for me, I didn't know if I noticed a lot of like regrowth, but it definitely stopped from like any more hair loss.
Yeah, PRP hair it's a little bit different animal, only because there's so many factors that can influence hair loss. Whereas, when we're just trying to regrow collagen, it's a little bit easier. Stress, sleep, genetics, nutrition, all of these things affect your hair follicles.
Yeah.
Which is, a little bit different mechanism of action there than just building collagen.
So what about with exosomes? Because that will, you've been doing a lot of the PRP with exosomes now.
Right. So exosomes kind of accelerate the regeneration process because they're the signaling molecule of stem cells. And they really like the environment of PRP, so they're a good combination. So we combine the exosomes with the PRP and inject, and we can pretty much combine that for any PRP treatment. You can add exosomes to it.
And it just boosts it.
Yes. So I have found that we do get better results with hair restoration when we add the exosomes. Yeah.
That's next for you.
Yeah.
Yep.
Let's see. What else have we done? What else could we do to you?
I don't know.
I think you're doing pretty good.
Yeah.
Just maintaining and, I
think it's partly a testament, though, to the way you take care of yourself. I mean, people who have bad lifestyle habits are not going to maintain their results as well as other people. But good skincare, staying hydrated, exercising, eating a good diet, getting good nutrition, avoiding toxins like people who smoke, right? That's just full of toxins that just really congest your skin. So, avoiding those kinds of things is important too. So I think,
Yeah, because I am pretty healthy as far as that line. I don't do any of those.
You make people healthy for a living, so...
Yeah. I gotta look the part.
When you walk
I gotta
in,
look what I'm selling.
practice what you preach.
Yeah.
Exactly.
If I gotta try to convince somebody that I'm gonna make them healthier, I better look like I'm healthy.
Yeah. Right. Well, I think you're doing a good job.
Oh, thank you.
There's something to be said in business in general across the board. About people that are fit, whether you're
well, it says something about your ability to be disciplined, right?
Yeah.
To be driven and to be organized and committed. So.
Yeah, to keeping that part up and also a business. And,
Yeah. All right. Well, it's been great. Nice knowing you. No, it's been nice talking to you. And thank you for coming in today.
Absolutely.
To be on our podcast.
My pleasure.
We just love you.
I love you guys too.
Yeah.
We appreciate you. Thanks for coming
thank you
in.
very much.
Thank you for tuning into this episode. And if you have any questions, you can give us a call, or comments. You can give us a call at Ageless Anatomy at 480-925-3963.